Injectable fillers are soft tissue fillers which are injected on the skin to reduce the appearance of wrinkles and restore a smooth and soft skin. So if you suffer from hollowness under the eyes, laughing lines, or any other kind of wrinkles, this is actually the show for you. Thank you so much for joining me. My name is Sarandanu Teshna, and this is the Skin Therapy Show. Good evening back at home. Thank you so much for joining us on this week's edition of the Skin Therapy Show. I'm your host, Sarandanu Teshna, and today I'm here with one of our very good friends, Dr. Pancholi, who happens to be one of the most sought out dermatologists in the country. Welcome to the Skin Therapy Show, Dr. Pancholi.
Thank you, Sarah. It's a pleasure to be here.
It's a pleasure as well. You're not a stranger to the Skin Therapy Show, but as norm is, please just introduce yourself to us. Tell us what you do and how long you've been doing this for.
Okay. So I am a cosmetic dermatosurgeon. I've been practicing for the last 10 years. I studied cosmetic medicine and dermatology at Harvard Medical School. And I'm board certified by the American Academy of Aesthetic Medicine, and I'm board certified by the American Board of Laser Surgery. And I do aesthetic treatments to work on the eye bags, the laughter lines, the crow's feet. We do body contouring, slimming, skin tightening, stretch marks, cellulite, whatever a woman needs to look beautiful.
Whatever a woman needs, so you know where to come. So there's one question that I've never asked you. Did you always have a passion in, doing Botox, fillers, helping out a woman?
Yes. You see, what happened is, as I was growing up, I was a geek. Obviously, in order to be a doctor,
of course, you have to be exactly,
geek.
Yeah.
So what happened is, I used to have very big Coke bottle glasses, and I would always be with my books, carrying them around and everything.
And the sweater, I can just imagine sweater and the cabot tie. Ladies and gentlemen, today we are talking about fillers, and just in case you have any questions in regards to this particular topic or anything that you might want to add, please do make sure that you hit us up on our social media pages. That is Facebook, The Skin Therapy Show. Instagram and Twitter is at The Skin Therapy Show. So let's talk about fillers, one of my most interesting topics. I'm sure there are a couple of people out there who don't know what fillers are. So maybe you can just introduce this topic to us.
So dermal fillers, F-I-L-L-E-R, it is used to fill the lines.
Okay.
Yeah. So you can think of it as similar to a crack in the wall, and you use cement.
You just plaster on top of it.
Yes. So it's like plastering, but for doing facial contouring. So using fillers, I can actually lift the nose, give somebody a bridge. Yeah, so people normally have those very flat noses. Yeah. So we can give you the high arched or European nose. All right. We can get rid of eye bags. Yeah, we can get rid of laughter lines. We can get rid of deformities and scars. And we can improve the overall appearance. Now, dermal fillers are of different types. The most commonly used is from a substance known as hyaluronic acid. Hyaluronic acid is a naturally found sugar that is found within our bodies. Yeah. So
fillers can only this kind of treatment can only happen on the face, not any other part of the body. That's what you're trying to say, right?
No, not at all. In fact, we use fillers on the face. Ladies who say their hands have become old and they look wrinkled, or when they've been washing the hands too much, or even washing clothes too much, then you see that the hands look very aged. We can use fillers on the hands, we can use them on the knees, we use them on the neck for the turkey chin.
So anywhere that you feel like it's aging and it's wrinkling a little bit, you apply.
Yes, in most cases you can.
In most cases. So how do you get to determine the right person to undergo this kind of a treatment?
It's a professional analysis, so they come in for a consultation. We look at the patient, we see what they need, what they want, and then we analyze. There's something known as profiloplasty, where we look at the profile and then we decide accordingly as to what and how we need to do things.
Okay, and you keep on mentioning the dermal fillers. Are there any other different kinds of fillers that are there?
Yes, there's different kinds of dermal fillers. There's polyalactic acid, hyaluronic acid. Hyaluronic acid is made from different kinds. There's the shape technology, Nasha technology, Vicross technology, and then we have calcium hydroxyapatite, which is radius. So there's a whole range of fillers out there, and a decision on what filler to use is made after a discussion with your cosmetic dermatosurgeon.
Okay, so how many sessions does one need, or does the deepness of the or rather the hollowness, especially when it comes to the under eye, does it determine how many sessions one will need, or is one session enough?
In most cases, one session is enough. The key that most doctors everywhere in the world fail to realize is that they overtreat. They put in too much substance into people's faces, which is why you see actresses with like those big lips and things like that, which is unnatural. Now, in most cases, you want to use a very minute amount and see and work on it and see how the patient looks, how the patient feels, and then the patient can always come back for more.
All right. Well, I'm sure there are a couple of people out there who are lost and they still don't understand what fillers are all about. So I think it's now time that, me and you get to go and do this kind of a treatment. So please do not go too far. This is going to be quite exciting.